Hello, my name is Austin, and I'm going to be your nurse today. Can I have you please state your name
Allison Walker,
and your date of birth?
July 19th, 2000.
Okay, good. I'm going to now perform hand hygiene. Can you please tell me where you are?
Shadow Health General Hospital
Do you know why you're here?
for a checkup.
And do you know the date?
November 23rd.
Okay, good. I'm going to first inspect your head, ears, eyes, nose, and throat. I don't see any lesions or bruising. I also don't see any ptosis. Everything seems to be symmetrical, no asymmetry noted, and hair growth is good for age. I'm now going to move on to palpation. I'm going to feel the skull and head for any masses. Do you feel any tenderness?
No,
I'm going to move to the ears. Do you feel any tenderness?
no,
Now I'm going to move on to the sinuses. Starting with frontal, do you feel any pain or pressure?
no,
Okay. Now maxillary, any pain or pressure?
no,
Okay, I felt no masses, and the patient stated that they felt no pain or pressure. Now I'm going to move on to the mouth. Can you please smile? Okay, good. Your smile looks to be symmetric, and can you please stick out your tongue and say ah? Okay, the tongue seems to be pink and moist, and your uvula seems to be bilateral and symmetrical and midline. Good. And I'm going to move to the eyes. I'm going to start with my pen light. Please look at my finger. Don't look at the light. Good. Look at this finger. Good. So pupils are equal, round, and reactive to light and accommodation. Please follow the pen light. Good. And now I'm going to be looking at the sclera. The sclera is white. And can you please move down your eyelids? And the conjunctiva is pink and moist. Good. Okay, now I'm going to move on to your lymph nodes, starting with your preauricular, postauricular, occipital, submantle, submandibular, jugular digastric, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Did you notice any tenderness or pain? Good. I did not feel any masses. Next, I'm going to go ahead and move on to respiratory. Okay, first I'm inspecting. Your AP diameter is 2 to 1. Your thoracic cage is pointing down. I don't see any masses or edema or bruising or scars. And I don't see any signs of labored breathing. Good. Now I'm going to go ahead and palpate for any masses. Do you feel any tenderness?
no,
Good. Okay, now I'm going to have you, the patient, turn around. Can you please turn around, please? Okay, now I'm going to assess for a symmetric expansion. Please take a deep breath. Good. Expansion was symmetrical. And I'm going to go ahead and test for CVA tenderness. When I palpate, please tell me if you feel any tenderness.
no, no,
Good, no tenderness. Now I'm going to auscultate for your breath sounds. Please take a deep breath. And I'm going to auscultate in a Greek pattern, avoiding any bony prominences. Good. Can you please lift up your arms? Listen for your lateral lungs fields. Good. You can come over ready to turn over. Normally I would listen to your anterior sounds, but for the point of this exam I will not be. I'm going to go ahead and move to your cardiac system. I'm going to go ahead and inspect. I don't see any pulsations or heaves or any abnormal beats. I'm going to go ahead and assess your skin. First I'm going to do skin integrity. I don't see any skin tenting, and I'm going to go ahead and move to catheter refill. Okay, good. Your catheter refill is less than 3 seconds. I'm now going to move on to your arteries, or your pulses, your radial pulses. Good. Brachial pulse. Good. Femoral, popliteal, posterior tibialis, and dorsalis pedis. Good. All your arteries, I could feel pulsations. Next, I'm going to go ahead and move to auscultating the heart sounds. I'm going to first start at the second intercostal space at the aorta. So aortic, pulmonic, Erb's point, tricuspid, and mitral. I would then stay at the mitral valve for a minute to listen for PMI. Okay, and then switch over to the bell sounds and go back in the same order to listen for any murmurs or S3 sounds. Okay, good. I then would have the patient lie down in supine and left side lying and listen to heart sounds again. Okay, good. And then I would switch to the bell sound and listen for carotids for any bruits. Okay, good. Now I'm going to go ahead and move on to the abdomen. Can you please lay down supine and knees up? Good. Have you gone to the bathroom recently?
Yes.
Okay, good. So the bladder is empty. I'm going to go ahead and move up the patient's shirt just so the abdomen is exposed. I'm going to inspect. I don't see any color changes, any abnormal hair growth. I don't see any rashes, bruising, and I don't see any ostomy bags or any wound care needed. I'm going to go ahead and auscultate for any bowel sounds, starting with the right lower quadrant, right upper, left lower. Okay, your bowel sounds are normal active. I did not hear any abnormal sounds or no sounds at all. Next, I'm going to move to percussion. Good, your sound sounded tympanic and to be expected. Next, I'm going to move on to palpations. Please, light palpations. Please tell me if you feel any tenderness. Good, any tenderness?
No.
No. Now I'm going to move to deep palpations, starting with right lower quadrant, right upper, and left lower. Did you feel any pain or tenderness?
No.
Good. So there was no pain or tenderness, and I didn't feel any masses inside. You can go ahead and sit up for me. Now I'm going to go ahead and move on to the musculoskeletal system. I don't see any signs of kyphosis or scoliosis. I don't see any edema or pitting edema. I don't see any abnormal hair growth. For your hair growth seems to be your age, and as for your gender. And I don't see any bruising or scarring. I'm going to go ahead and test your strength. Go ahead and grip me as strong as you can. Good. Your hand grip is symmetrical and bilateral. And go ahead for your feet. You can push against me. Good. Now pull. Good. Your strength and your lower extremity seems to be bilateral and good for your age. And that is it for our exam, and the doctor will see you soon. Thank you.